Hello and salam from Dubai. I'm currently on my way to the International Society for Heart Research World Congress in Berlin, where we are very excited to be presenting the work we've done with Implicit over the last few years, which is now a collaboration with over 20 field-leading scientists around the world and at the Baker Heart and Diabetes Institute in Melbourne, Australia. Now, we've recently delivered some very exciting work to Implicit's scientific team. But first, to recap, what prompted that investigation was the earlier findings, which revealed a very protective, a consistently protective, effective anti-CD14 therapy following myocardial infarction in preclinical models. Some of those impacts were incredibly large, 30% improvements, 50% improvements, depending on the metric, which it's very clinically significant and prompted a lot of interest from cardiologists in our network and in Implicit's network. So that then led to the focused investigation of what factors might be driving this protection. So for that, we looked earlier at in the earlier phase of healing following myocardial infarction in the same models. And what we've revealed with some truly sophisticated state-of-the-art approaches and technologies, single-cell RNA sequencing and proteomics and immunohistochemistry, to name a few, is that at the center of the disease progression, what anti-CD14 is interrupting is this key immune cell, the macrophage, and we're conclusively shown that it's that anti-CD14 reprograms this key immune cell, being less inflammatory, contributing less to the excessive inflammatory response following a heart attack, and allows for more of a reparative function. Now that's very exciting, not just in the cardiovascular space, but also beyond myocardial infarction. There are other ischemic injuries and other progressive disorders that are associated with a very similar mechanism. So as excited as we are in the cardiovascular space, I think Implicit has plenty of right to be excited about. There are other indications and other programs and other pathologies. So I'm very grateful and thankful for the opportunity to conduct this work and now share it with the scientific community, who I anticipate will be very excited and stimulated by this new approach to interrupting inflammation in different diseases.